The topic is orthostatic hypotension, which means a person lies down in the bed and he tries to sit up or stand and walk suddenly. In that situation, suddenly he collapses. And this happens within 1 to 3 minutes of getting up from the bed. So this situation, this condition is called as orthostatic hypotension. Hypertension, the word is very common, means the blood pressure is high. Hypotension means the blood level goes down. So how much is a normal blood pressure? Normal blood pressure for any person is 120/80, means systolic pressure is 120, diastolic pressure is 80 millimeters of mercury. So in this condition, for any person, when they lie down, normally the BP is little high, and when they sit up, the BP becomes less for first 1 to 3 minutes. Then it becomes okay. Let me tell you about heart rate. When a person is lying down, his heart rate is normal, but when it gets up, sitting or standing position, the heart rate increases by 10 to 30 per minute. It is just opposite of blood pressure. This is for a normal person. So when a person gets up from bed and he walks normally, nothing happens to him. But what are the changes which usually happens? From the lying down position, when a person gets up, because of action of gravity, approximately 500 to 1000 ml of blood starts flowing down towards the leg. Say average 600 ml. But still nothing happens. What is supposed to happen? When so much of blood goes down because of gravity into the leg, what happens is the less blood goes to the brain, so there will be a hypoperfusion in the brain. So because of hypoperfusion, the person starts getting giddiness. This is what is supposed to happen. But a normal person doesn't experience this. Why? In spite of this blood flow, there will be body changes which happen within 1 or 3 minutes, very fast, which doesn't allow the cerebral circulation to come down. So what are the changes? So what happens is, in spite of the blood going down in the leg, approximately 600 ml, there will be compensatory mechanism like one, there are baroreceptors in the neck. Means there are receptors in the main blood vessel. One is in the aorta and the other is in the common carotid artery. So what happens is this senses the change in blood volume. This sends signals to the heart. At the same time, there will be splanchnic contraction also. And the heart rate increases. It pumps more blood. Signal goes to the periphery, saying that there will be vasoconstriction and the redirection of blood. All happens very fast. So because of recirculation, brain doesn't suffer from decreased blood flow. It maintains his normal blood flow. So he will not get any giddiness. So what happens in orthostatic hypotension is, when he gets up from the blood, this system doesn't work properly for him for the reason which I'm going to tell you. And there is, because of gravity, blood flows down to the leg. There is the baroreceptors doesn't sense much. Signal doesn't go to the heart properly. Heart works normally, but that is not enough. Blood circulation, brain comes down. There is hypoperfusion. He develops giddiness. That is what happens in orthostatic hypotension. Now, what are the causes for it? So let us divide it into two. One is physiological, one is pathological. Physiological, it can happen to any normal person, you or me, anyone. Pathological, he is a patient and that is permanent. Physiological, it is temporary. So first let us see the causes for the different causes I have told you, and let us see the causes for physiological orthostatic hypotension. Any person who has been fasting and after the fast he is not taking, his intake is very less and his number of days of fasting also is increasing. His intake is not proper. That is one. Anyone who is standing in the hot sun for a long time, or somebody who is not used in crowded places, or he has got mild fever and he is exposed to warm environment, or little more common things, emotions. See, suddenly you break a news that this particular person whom you are very close with, he has passed away. That person will get up and he may collapse. Sight of blood, sight of any medical procedure being done, the person who is watching, they may fall down. Any fear, even that time they can fall down. So these are all causes for physiological causes. It happens in a normal person. He is not a patient. Now, coming to pathological, where I'll divide into three main causes. One being endocrine, second is autonomic system problem, third is cardiac problem. The endocrine problem, those patients with thyroid issues, thyroid dysfunction. Second being, there are small glands called adrenal glands which are placed just above the kidney. When you have problem with the adrenal gland, they also can experience like this. Coming to autonomic system dysfunction, means in the body there's a separate system called autonomous system which comes under the central nervous system. I'll give a small example for that. See, when we eat, as long as the food content is in the oral cavity, it's under your control. If you want, you can spit it out. If you want, you can swallow. Once you swallow, then it is not under your control. It goes through the food pipe to the stomach, to small intestine, large intestine. It's not under your control. Heart rate, the beat increases, decreases. It's not under your control. All these are controlled by the autonomic system. It works automatically. When there is a failure of autonomic system, there is dysfunction. Whether there be central cause or peripheral cause, this can result in orthostatic hypotension. Central cause being Parkinsonism or any neurodegenerative disease. And peripheral cause, which is more common than the central cause, peripheral cause, number one cause being peripheral neuropathy. The common cause is diabetes. Patient is taking medicine properly, but the disease has been there for a long time. He has been suffering from diabetes for a long time, so there are changes in peripheral nerves. Other common causes being vitamin B12 deficiency or folate deficiency. Coming to the third cause, any person who has got any heart-related problems like cardiac failure or myocardial infarction, or their heart rhythm is not normal, either beats irregularly or beats less, or they have valve issue, especially aortic stenosis. All these persons or patients, they can suffer from orthostatic hypotension. Now coming to iatrogenic causes. Those patients who are taking more of diuretics, or they are hypertensive, they are taking medicine for that, and by mistake they have taken double the dose. Same thing happens with antipsychotic psychiatric patient, he takes double the dose. And the same thing, he doesn't eat also. Suppose it happens, they also can. Normal person, he taking sedatives in the night. By deep sleep, you ask him to get up, go to the toilet, suddenly he may get orthostatic hypotension. These are all iatrogenic causes. Coming to the investigation, I have told I broadly divide into physiological and pathological. Correct. Now, physiological, you don't need any investigations. The investigations are needed only for pathological conditions, or physiological when it happens again and again. It repeats and we need to know it's only physiological, it is not pathological. Only in those conditions we need investigation. To start with hemoglobin, we have to check hemoglobin. In diabetic patient, whether the blood sugar is under control or not. And blood sugar is under control or not. And the thyroid function test, whether the thyroid function is normal or not. So for that we have to do 3T, 3,4 TSH. And another thing is electrolytes. We have to do the electrolytes. Sodium is less or not. Usually potassium will be maintained. And last being related to the heart, ECG, if needed Holter monitoring, and if needed treadmill. These are the common investigations which are needed. Now coming to the treatment part. In the treatment part, physiological condition, most probably, most of the time, it gets the local people there, they manage it. The person who's near you, they manage it well. How they manage it? They make the person lie down for some time. They sprinkle some water in your face. They clean up the face with water. And as soon as you become normal, they'll make you drink something. And one other person will help you with ventilation. Also. They may wave something so that you get proper air. The best thing, don't overcrowd in that area. Let the patient be okay. Let the patient get some oxygen. When the person sits up, let the person drink some water first, followed by some juice containing salt and sugar. So that will solve it. Now, anemic patients, treat anemia. Hypertensive patients, guide them properly, not to overdose themselves. And diabetic patient, give them good guidance, how to take the tablet, how it has to be maintained. If the patient is exposed to, when they go in the crowded place, tell them, try to avoid all that. We know the patient is very sensitive. Don't allow them to see any medical procedures, seeing blood, or any procedures, avoid. We know the profession is, they have to stand for a long time. Ask them to wear stockings. A stocking has to reach up to the waist level, especially if they have varicose vein. They have to treat varicose vein. And by the way, for varicose vein, we have to do, if you want to find out, we have to do Doppler, venous Doppler. That's how we come to diagnosis. So in that case, either treat it surgically, or if it's in the early stage, you wear stockings. So this is the way you treat one by one. And there is one more point which I want to tell you, that there are few patients who complain that as soon as they eat something and they, after the food, when they, after finishing the meals or dinner, when they get up, they get giddiness. What happens? Reason is the same, orthostatic hypotension. Why? Because the meals they are taking, their carbohydrate content is more. So it is better, we'll advise them, decrease your carbohydrate content. One more thing I have forgotten to tell you before, the orthostatic hypotension is more common in elderlies because of so many causes. This is not to be neglected, because repeated orthostatic hypotension in elderlies, it can precipitate cardiac issues and it increases the risk for stroke. That's why. Now, the treatment modality I have told you one by one. The patients used to come and ask me, sir, tell me, we will do all that, whatever you are saying, and we will try to keep the disease under control. Give us some tips so that when you get up from the bed, it's going to help us. First thing is, when you sleep, please use head pillow. Next thing is, I'll show you a video which will help you to understand better. So when you get up from bed, you get up, sit on the bed itself for 30 to 45 seconds, less than a minute. Don't jump up out of the bed as soon as you get up. You sit on the bed for 45 minutes to 1 minute. Then slowly you put both your legs outside, tangle your legs, and keep on moving your legs for some time. That is again for 30 seconds to 1 minute. So what happens? You're exercising your legs, you're trying to recirculate the volume which is getting, blood volume which is getting collected in the lower part of the body. Now, doing that, you stand up for some minute, for 30 seconds. After that, see what he is doing. He is raising himself up. Only the heel will go up. Then you start walking. So by doing that exercise, what you're doing, the muscle, you're trying to activate the muscle and pump the blood properly. So when you do that, you see to it that you hold to something so that you don't fall down. Then you start walking. By doing this at home, this is going to decrease your chances of falling and your chances of orthostatic hypotension. This will really help you. So there are so many medications, but the main thing is you have to treat the primary cause, not jump into these medications, because these medications are for those patients the primary cause has been dealt with. In spite of that, it is not getting controlled. But usually in majority of the patients, if you treat the primary cause and the way you get up from the bed, like how I have shown you, that will be more than enough, and it can be easily brought under control. So this is how we manage orthostatic hypotension. Thank you so much.